This is no ordinary video on erectile dysfunction. I am going to talk about the last frontier of ED diagnosis and treatment, the no man's land I frequently find myself in because I see a lot of patients who have visited many doctors before me and nobody had been able to solve their problems. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. Doctor's orders? Subscribe to UroChannel now and become part of the UroChannel community with new videos on urological and sexological topics each Wednesday and Saturday. Generally, erectile dysfunction is the inability to achieve or maintain an erection durable enough for intercourse. Should you suffer from erectile dysfunction, you are not alone. It may start early during your 20s. But usually it is observed after the age of 40. Once you reach 60, ED can be found in 20 to 40%, and only one decade later, age 70 and above, it is 50 to 100%. Most of this is pretty forward stuff. Age, medication or disease-related side effects, vascular problems, neurogenic ED, hormonal problems, penile diseases, and ED of psychogenic origin. When all of this has been ruled out, a small group of patients remain. They suffer from erectile dysfunction from a largely unknown origin where medicine, for the time being, has little to offer. Most textbooks will not deal with these diseases, and there are only few scientific publications about them. For some of these conditions, we have names: Glans insufficiency syndrome, Hard-flaccid-syndrome, Overactive corpus cavernosum, Hypoactive corpus cavernosum. And I personally think that venous occlusive erectile dysfunction in young men also belongs to this group. Let me just go through them quickly. I will divide the video into chapters for you to enable you to jump back and forth. Glans insufficiency syndrome, also known as cold gland syndrome or soft gland syndrome. This is an isolated form of erectile dysfunction of the corpus spongiosum. As a result, the penis erects, but the tip of the penis, the glans, stays soft. This causes major problems with vaginal penetration because a rigid object with a soft top has little penetration power. Many patients report a cold feeling at the glans. That's why it is called cold gland syndrome. This problem is frequently seen in Peyronie's disease, but I've seen patients where the cause behind this was nebulous. Hard-flaccid-syndrome is a condition with a semi-rigid penis at all times, with odd sensations and pain, and even here, the glans feels cold sometimes. Despite the fact that the penis doesn't get flaccid anymore, it has a hard time to fully erect on the other hand. Hard-flaccid syndrome is getting more attention in the medical community now, but we are far from having an understanding, let alone an effective treatment. The overactive corpus cavernosum has been described some 20 years ago in a small case series of patients with ED who were assessed by electromyographic measurements of the corpus cavernosum. It could be shown that smooth muscle activity in some of these patients was pathologically increased at all times. As you might know, the corpora cavernosa of the penis consists of smooth muscle. Unlike any other smooth muscle of the body, the penis works in a kind of reverse mode. Usually, smooth muscle is relaxed and gets active to fulfill its function. In the penis, it is the other way around. Smooth muscle is active and relaxes for erections. In the hyperactive corpus cavernosum, the muscle has a hard time relaxing, thus inhibiting erections. Which brings me to the next phenomenon, which I think might be related: venous occlusive ED in young men. This is when blood enters the penis through the arteries, as it should, but can't be trapped inside the organ and leaves it through the veins immediately. The usual mechanism how to keep the blood inside the penis is this: smooth muscle relaxes and the corpora expand. The increased pressure will shut off the veins by pressing them against a firm structure, the so-called tunica albuginea. In venous occlusive ED, this is not happening, especially after radical prostatectomy for prostate cancer. it is easy to understand what the problem is. The corpora begin to shrink and can't fully expand anymore. But in young, healthy men, could this be the result of a hyperactive corpus cavernosum? I recently treated a young patient with verified venous-occlusive ED who claimed this happened when he was treated for an infection with ciprofloxacin a couple of years ago. I spent several days on the internet trying to find out more about it, but so far this kind of side effect hasn't been described. Therefore, if you experienced something similar, please leave a comment. The hypoactive corpus cavernosum is the opposite of the overactive corpus cavernosum. It is described in a small case series with electric measurements and even biopsies from the penis. The electric activity of the cavernous smooth muscle is reduced in these patients, and the electrocavernosogram showed even irregular waves. The microscopic appearance of the biopsies revealed degenerative changes. I hope you made it this far through the video so that you by now have an idea about these special problems. Since we have a hard time defining these conditions, treatment gets difficult as well. It is an individualized approach, and in my opinion, sexual counseling of the couple has to be an integral part of this. Several options can be tried, but sometimes a penile prosthesis is the only solution left. Thanks for watching. Bye-bye.